morning. Welcome to the Medical Hour. Don Elwell here with you. With special guests, Lakeside Dental Arts has sent their crack team. Half the team is here, actually, I think, is what we're dealing with here between Dr. Dalton Helvey and Dr. David Campano. Good morning, guys. How you guys doing?
Doing all right. How are you?
And, of course, we certainly cannot ignore the fact that photography. Anthony is here, accompanied by Jerry, as we speak here, as he is catching us in the early morning, way before the makeup team got in here. I'm going to go ahead and say that. Exactly. Lakeside Dental Arts, of course, for those of you that are not aware, located on the south side, a little bit of Sebring, South Central, we'll call it. 2660 US Highway 27 South, on the shores of Lake Jackson. Absolutely gorgeous shores of Lake Jackson this morning. Crystal blue skies. And of course, you can give them a call. Their offices opened up just seconds ago. 863-658-4288 is the phone number. They're open from 8 till 5 today and every weekday over there at Lakeside Dental Arts. So what's new and exciting over at Lakeside Dental Arts, guys? What do you guys got going on? I would imagine that snowbirds probably are starting to come back, right?
Yeah, our northern friends are making their way back down. Seems like they've been coming back steady now for a month or so, and so it's good to reconnect with all of those who have been with us before and even those who haven't. So you can feel the roads and grocery stores are getting busier.
Oh yeah.
So are the dental chairs. You know, it's a lot of fun. We're keeping up.
So this is your second season, right? That you worked at Lakeside Dental?
Yep, that's my second year being back here. So it's
so you definitely are seeing, I'm sure, the increase, if you will.
Oh yeah.
And Dr. Campano, you're just seeing more people.
Yeah.
You didn't realize they were probably you know who they were, right?
Yeah, no, there's been a couple familiar faces for the rest of the team. So.
All right, they must have moved the microphones around on me. I apologize for that, but we'll get you fixed up there. Anyway, so now with yourself, have you know? What I mean, are you saying it's like 10% busier, 20% busier? How, if you had to put a number on it, how much would it be?
For myself, I'd say probably a good 20-30%, depending on on the day. But
so that's a lot. I mean, it's quite a bit when you were fairly busy to begin with.
Yeah, definitely.
Absolutely. Okay, very good. And now, one of the things I think that separates you guys out from a lot of folks is the ability to, especially now that you have 4 dentists between yourselves, of course, and then Dr. Musa, Dr. Willie, obviously. Then now you probably have as much capacity, if not more so, if you have somebody that's brand new to the area or just coming down again for the 6 months or so, is the ability to get an appointment if they have an emergency or a real big need, same day.
Oh yeah. Yeah, we have people call in every day asking, they have a crown came off, a tooth broke, what have you. And so, they call early enough in that morning. A lot of times we're able to see them the same day, which is phenomenal. Sometimes just a few hours later. And so the earlier the better you call, the more likely you're going to be able to get in that same day, and spots fill up fast, we block out spots for emergency visits every day,
right?
And we fill those spots every day. And I mean, we're constantly looking at things. We have, someone calls, they're in pain. We're going to do our best to get them in our chair and at least take a look. And a lot of times, I would say more often than not, most of the time we're providing treatment that same day, whether it's a removal, root canal, and a crown.
That's not easy.
Filling.
You can do that same day. Same day. I kind of figured all you could really do was just say, "Yep, I can see why that hurts," and we'll schedule you for 2 weeks from now. That sort of thing, as opposed to being able to actually kind of fix it in the same day. That's impressive.
And I think it just goes to show the hard work and effort our team puts in, really, because it has nothing to do with us. Our team's the one getting the chair in the room ready. The front desk team are the ones coordinating and finding that spot, getting them in, getting the paperwork filled out, and then the back team is the one ready to serve them, gets them going, gets the x-ray, comes and lets us know. And it's just so efficient. Dr. Willie obviously has been doing this for just a few years, so it's incredibly efficient. That something a lot of offices can't do
on the fly
due to the efficiency, whether they don't have the capacity or the efficiency.
So Dr. Campano, do they kind of do the staff, do they let you know on the fly, or do they let you know a little bit later on as it goes? I mean, when they make that change, do they kind of come in and say, hey, remember that hour of lunch you're going to have? Yeah, now you have to chew while you're walking, kind of thing, or when do you get notified that you get an additional person or two?
Yeah, no, I'd say We're used to skipping lunch, but it's not a bad thing. It just kind of depends on what time someone calls. If they call in the morning and they schedule for 1 o'clock, then we know in advance.
Wow.
If they walk in, we'll take them. So
Okay.
it just depends on the day. Sometimes you get 10 minutes notice. Sometimes you get a couple hours notice. But
Yeah.
that's all right. I would treat you all the same regardless. So.
Yeah, you just adjust with it, roll with it a little bit. Oh, and that's a big difference, and that's probably one of the reasons why they've got 1,000+ 5-star ratings. They're over 1,000 now, and still the average is 5 out of 5. It's a pretty darn impressive number, it really is. And a lot of if you look at a lot of them, of course, they're all reasonably recent. So you're going to see like a bunch of them from just like the last month or so, and a lot of them refer to the fact that I had a pain, they were able to get me in right away. I mean, just this whole, like as you kind of mentioned, a whole cohesive team effort from the person that answers the phone to the receptionist to obviously the hygienist to the doctors themselves, back to the cashiers at the end. I mean, all the way through. Everybody is just really, really committed to that kind of excellence.
Absolutely.
And I love the fact that that's kind of part of the culture. LakesideDentalArts.com, by the way, is the website for them. If you would like to take a look at it and see what they do, all the different services. We're going to talk about them, though, in just a minute on the Medical Hour. God, hell well with the Medical Hour. Not even paying attention to the time. It's crazy how we're getting into heavy conversations about golf and things like that. Anyway, so we're talking with Lakeside Dental Arts, the two newest of the two doctors. I'm not going to call them the rookies because one of them's seasoned. He's been with us for almost a little over a year now, right? How long have you been?
Yeah, about 1.5 years now.
Year and a half.
Been back. So
and Dr. Campano definitely is the rookie, but he's been with them for a few months now. It was trial by fire during the summer, correct?
Yeah, started July 1st.
Yeah, there you go. So he's got a little seasoning there before the northern folks came back on down, and now starting to fill up the chair a little bit more frequently. They got 13 different studios or suites, I guess you call them there?
Operatories. Yeah, so
okay.
13 chairs there, 12 of them overlooking Lake Jackson. As you've seen, beautiful view there.
Yeah, absolutely.
It taunts us every day when it's good weather.
Oh, and today it's just a gorgeous day.
Yeah, people just cruising by on their pontoon boats, just living the dream, and here we are stuck inside, doing what we love, but still stuck inside.
Yeah, well, I mean, but it's not. But for the patients, though, you trust me, you will not find a better experience. In addition to the view, if you don't like the view, you've got like a couple of TVs to choose from.
Yeah.
You can be doing that. You got a heated massage chair that you're in. You've got water available. There's like a neck pillow. You guys just go all out to make these folks feel comfortable.
Yeah, and it's all about removing as much stress and anxiety. Most
Sure.
people have had traumatic experiences maybe when they were younger with the dentist, and dentistry has changed a lot. So what we know now is just so different. So Dr. Willie and Allison Willie, his wife, has thought through every nook and cranny when it came to this practice when they opened it over 5 years ago, and a lot of that has to do with just the comfort side of things. We want you comfortable, relaxed, and that involves TV and blanket, massage chairs, whatever it takes, just to kind of be able to keep your mind off of everything else we're doing. 'Cause no one wants to hear or see the things we're doing.
No, absolutely. I mean, back when we were all much younger, there's a little bit of a medieval kind of torture kind of thing going on there, and that's a little bit different now. And especially now, Dr. Campano, have you ever seen a medical office, or at least a dental office, excuse me, that is like this one?
Like ours?
Like yours?
Yeah, absolutely not. No.
Not even close. No.
Yeah.
I mean, it is. It's almost like a spa.
Yeah.
That same general quality, if you will. It's serious. I want to go in there and get a cleaning, perhaps a little Swedish massage, a pedicure. That's why you just feel like you're going to order the whole gamut when you walk in there. Even to the point when there's crystals and stuff like that in the lobby area there, and then there's coffee and juice, and I mean and people that have to wait there. I have yet to see anybody in the waiting room that looks like they're mad because they're in the waiting room.
Right.
They're all just fine, just good. Everything's great. Everything's wonderful. And
it doesn't happen at the physician's office.
No, it does not.
Everyone looks like they're going to attack the reception.
Yeah, or it looks like the DMV or something. Where you're there for like 3-4 hours and stuff, and it doesn't happen. And you all do a great job also of if you've got an appointment at 10 o'clock or 11 o'clock, it's pretty darn close. I mean, there's no we're going to be 3-4 hours late because so and so in front of you got held up or whatever. You don't have that problem at all that I've seen anyway.
Yeah, and that's what we really schedule out our schedule for the day. It's very well organized so that we can minimize that experience. We understand the patient's time is just as valuable as ours.
Sure.
And that's how people feel when they're running behind at another business or organization. So we try and minimize that as much as possible.
Yeah,
and that also contributes to the TVs, the blanket, the massage chair. We don't want you sitting out there waiting for an hour on us to get your filling taken care of or get to your cleaning. So. And things happen. Things take a little bit longer, sometimes more than others. And if we're running 5-10 minutes behind, our team automatically knows just to go and notify the patient that's waiting. Hey, the doctor's running 5-10 minutes behind. We'll be with you as soon as we can. So
yeah, but even that communication is not normal,
right?
Because 5 or 10 minutes in doctor world is we're early. You know what I mean? I hate to say it. I mean, many doctors. So for you to be only 5 or 10 minutes back, I mean, you get, like you said, it's a full team effort to do it because you guys, when you're scheduling, you'll schedule and you'll say, okay, this person's in for a cleaning that usually takes about X,
Right.
And so you give yourself a little bit of a buffer there, but in general, it's X.
Right.
Same thing goes with your fillings and your extractions and all of that. So, you clearly don't optimistically figure that you're going to do a root canal in 30 minutes,
Right.
that sort of thing. It's going to take a little longer. And we get that. So and I think everybody appreciates that quite a bit. So it sounds to me like your days they'll vary quite a bit, right? I mean, from cleanings to root canal. I mean, it's not like you're doing all cleanings one day, right?
Right.
You'll have quite a few different things to challenge you.
Yeah, we try to keep it nice and diverse. All of our schedules look a little bit different. So, we're all doing pretty much the same general procedures. Our hygienists are the ones that do the cleanings.
Right.
We're doing fillings, crowns, root canals, extractions, dentures, partials,
and you can do and we talked a little bit about obviously the whole philosophy and the culture and these are things that differ or differentiate, I guess, your office from so many others. Is everything from the people and the culture and of course we talked about the spa-like experience there, but you can do all those things in-house. And we were just talking a little bit during the break. You folks are almost kind of take it for granted because not everybody can. Is that right?
Yeah, I mean, I think we do a fair amount of different procedures at the office. We try our best to be able to offer things to patients with our own hands. We do refer out for complicated cases, of course, but we only do that when we feel it's in the best interest of the patient. So we really try to do everything as much as possible in-house.
Yeah, it sounds like you're doing quite a bit of it in-house. I mean, even simple things like extractions, there are folks that are referring those out these days, right?
Yeah.
And there's a time and a place for referral for any particular. Sure, we do root canals in-house, but there are ones that we recognize it's in the best interest of the patient to utilize Dr. Obermeyer's office here in town. And we're very fortunate to have, I believe, the best of the best specialists in our town, from Dr. Obermeyer, Dr. Kirsch, Dr. Gelf, orthodontist.
Yeah.
Dr. Ross Freeman is a new oral surgeon here in town.
And you guys partner with all of them?
Yeah, absolutely.
Okay.
So, sure, we do extractions. We do as many. A lot of people, they don't want to go to multiple different places and remember which appointment they had to go where for.
Absolutely.
But we recognize our limits. So there are absolutely times that you just have to have a specialist who does these things every day, whether it's a molar root canal or it's a wisdom tooth that's fully impacted and causing issues. So we recognize our limits. We don't want to cause more harm than good in the patient ultimately. So we know our boundaries and we know where to draw the line.
Well, and that's good. I think that you mentioned it just a minute ago, is that again, from the patient perspective, to have to go to more than one place is a pain. But it's also a pain to have to come back more than one time. And the fact that you can get all that done in one visit often, maybe the initial consultation, not that visit, of course, but the one following when you set up the treatment plan. And that's an important piece by itself too, because not every dentist office, I think, does the treatment plan. Explain a little bit how that works. So, okay, let's just say that I have not been to a dentist in 15, 20 years. and I did nothing but drink Coca-Colas from McDonald's, like that one, for those 15 or 20 years. So clearly there's going to be some work needed, right?
Absolutely.
So talk to me about what is that process then for that person, and how that gets handled at Lakeside Dental Arts.
Yeah, you know, going back to what Dr. Willie taught me from day one was if you don't get to the root cause of the issue, anything you do in the mouth.
Yeah, good
There you
job.
go. All
Yeah,
right.
nice.
Cheers. If you don't get to that root cause of the issue and you start doing work in the mouth, that's all going to fail quicker than it should. Right?
Sure.
So, prime example, Coke. You know, we have patients coming every day. Yeah, I drink a lot of soda. Sweet tea is a big one. And so,
especially down here. Yeah.
right, and we don't address that. Any filling, any crown, anything I do in the mouth, all I'm doing is adding more in there that you have to make sure you can keep clean.
Mm-hmm.
So someone like that with a very high sugar diet or just high, what we call high caries risk, high risk of decay.
Mm-hmm.
It starts with just getting that disease factor under control. So getting their gums healthy, getting rid of all the decay,
Right.
And taking it step by step. You know, if someone needs 10, 15 fillings and 3 crowns and 1 root canal, you know, we understand you may not have the time, you may not have the finances just to do that all in one day.
Yeah, I was gonna say,
I don't want to do that much in one day anyways.
Sure.
I mean, it's a lot on the patient. So, and that's where it becomes personalized. You know, we can sit down with a patient, hey, if you can only work 1 or 2 teeth at a time, we'll go through 1 or 2 teeth at a time.
Well, and if it's been 10, 15, 20 years since
Exactly.
you've been in there, then I would think that, you know, a slow recovery or slow upgrade process is going to be just fine. I mean, every visit is going to result in some positive progress, right?
Right, exactly.
Absolutely.
So, talk to me about, all right, so you guys set up a personalized kind of treatment program explaining, okay, Mr. Smith, you need this. Here's what we looked at. You know, we looked at all this. You can kind of see from the pictures that we took that you're going to need all these different things, and it's going to take this long roughly, and here's what I would recommend. Here's the biggest problems. We'll address those first. Is that kind of how it goes?
Yeah, absolutely. We prioritize things. I
Okay.
mean, you know, and originally one person might say, hey, your 2 front teeth are broken, but you have cavities back here. We need to fix those first.
Right.
Well, that patient doesn't value the cavities in the back teeth as much as they do their 2 front teeth. Say they're a hostess at a restaurant.
Sure.
Right? So they want their 2 front teeth fixed. So within reason, we can address their primary concern. I'll fix your 2 front teeth, but then recognize we got to get back in and we got to get those cavities taken care of in the back. Otherwise, we're going to end up in more involved treatment, possible tooth loss, infection, pain. And so that's where we really personalize our treatment plan. What's the priority to you? If it's pain, you have something hurting you, we're going to address that first before we worry about anything else. So, you know, it's all about what the patient desires. Obviously, our recommendations are going to follow an ethical code, but we want to make sure the patients are happy, they're comfortable, and they're confident about their oral health.
Very good. We're talking, of course, with Dr. Dalton Helvey, Dr. David Campano, Lakeside Dental Arts. LakesideDentalArts.com is the website for them. If you want to give them a buzz, you may do so because they've got receptionists. They're just sitting there waiting for that phone to ring. And that is 863-658-4288. Again, it's 863-658-4288. If you would like to speak to them, maybe get that initial consultation where they will take a look and say, okay, here's the path that we need to get your mouth a little bit healthier. And we're going to talk about maybe what some of the other places might be doing in this situation as the medical hour continues in just a minute. Don Elwell with the medical hour, talking with Dr. David Campano, Dr. Dalton Helvey, Lakeside Dental Arts, and LakesideDentalArts.com. 2660 US Highway 27 South in Sebring. The shores of Lake Jackson, kind of across the street from the All-Star Car Sales. And Culver's, of course, right there as well, and not too far from the Publix Southgate Plaza. Well, by the way, we're going to be talking a little bit of food with you guys in a little while because we got some food news that's very important, and also want to find out what you guys have been eating lately, and if you've some good restaurants or not. I know you probably, Dr. Musa, he's the healthy eater over there. Yeah.
He ate pizza at my house last week, though.
Really? Did you get a picture?
I did it.
He should have. Yeah. What kind of pizza was it though? Was it like a veggie thing?
No, I think he had a cheese piece. You know?
Oh,
I don't even count that as pizza.
Way to go out on a limb.
Right.
Yeah.
I think he did. We were having a parade work night for the float, and
okay.
it was either that or just fall out.
Okay.
Flat and hunger. So I think
got
he
it.
finally
I got
caved.
you. I got you. Dr. Campano, pizza? Yeah?
Oh yeah.
Oh, yeah. Yeah, okay, no.
Quite a bit that night too.
Yeah, it's a food group, not just the cheese, right? You went for the,
No. It was actually a real good one. There was we had like pepperoni sausage and
Nice.
Yeah,
Some kind of carnivore thing going on there. Yeah, that's good. Good stuff. Of course, Lakeside Dental Arts. Now, again, we were talking right before the break about the approach that they will take of really kind of personalized treatment plan, which caters to obviously the patient's needs, but also the patient's timeline and the patient's financial situation. And because again, you may not be able to afford everything right now, but if you spread it out over 2 or 3 or 4 months or 6 months, then yeah, it's a it's a little bit easier to take in smaller bites. Sometimes it has to go that way. But if it's taken years and years to get to that point, then that's 100% fine. It's like I said, you're seeing positive steps along the way. But other offices don't necessarily operate that way. I mean, I know that we've talked a little bit about kind of corporate dentistry, if you will, which I think kind of fits more like the one-size-fits-all mentality. Does that sound right or no?
Yeah, corporate. They've got a very kind of linear system for how they do their work, and it's less so individualized and more just kind of like, you have X, this is Y, this is how much it costs. Like that's what you need. And then there's not really a whole lot of variables in terms of input from the patient and kind of what they want to do and what their priorities are. It's just very straightforward.
Gotcha. So it's a more of a template kind of approach, if you will.
Yeah.
Okay, and that fits obviously for some. I mean, for some that kind of fit within that template, it seems like that would fit pretty well. But I would think that you might have some folks that are outside of that edge a little bit, more on the fringes, that the personalized approach might be better. Does that sound right?
I think the more you get involved with the needed treatment, the more personalized it needs to be. If you're someone who has absolutely no cavities, don't need any fillings, you just need your 6-month cleaning.
Sure.
Maybe that linear approach works for you, but it's not always going to be that case. Dr. Willie has always preached, and I will hear it till the day I die. Everyone has a lifelong need for dental care.
Mm-hmm.
Right? So whether you've had 1 filling or you've had 10 crowns and 3 root canals and multiple teeth removed, whatever your dental history is, you have a lifelong need for dental care. And so at some point, do you want to be in a place that's going to linearly
You got it.
It was close. I know what you meant. Yeah.
But anyway, so if you want to go to a place that's going to treat you just like another number, or they're going to customize and cater to your exact needs and recognize, and there's so much value people don't realize. I mean, just like using the same car dealership for years and years and years, they know the history of your car maintenance program, right?
Sure.
Using the same dentist for years and years and years, we know where you were from day one and now where you are 15, 20 years later. We have patients that have been a part of our practice for over 30 years with Dr. Willie, and I can look back to the notes on that very first day and see what the history of a single tooth is. So it just helps me better predictably plan the treatment they need and what more likely is going to occur, and it's just all in all better for the patient.
Yeah, well, and like you mentioned before, you kind of get treated like a number over at the other places. They've got to see a certain number of people a day, and you come in and it's you go like Dr. Campano mentioned, you go from A to B to C to D, and that's just the treatment plan. Here it is definitely a more again a personalized approach. We may have to slow down. We may have to things get explained to you a little bit, and they work with you. And you can't put a price on that. It's a huge value to do that. And like I said, it's such a difference. And people are really responding. Again, a 5.0 rating among over 1,000 people that are giving those reviews. It's just really, really important to understand that there's more than one way to kind of do this.
Yeah.
And it sounds to me like you folks really hit on the secret sauce.
And I think the big thing for me when I'm reflecting on like why does that make sense or how do I explain that to a patient, I realize that in a corporate setting, a lot of these dentists and hygienists, they provide just as good quality care as I would. It's not their dentistry is bad, but they have outside factors putting pressure on their decision making from a numbers standpoint.
Right.
For me, my outside factor that puts pressure on my treatment recommendations is longevity, because I plan on being here until I'm done. You know, I don't see myself leaving up in a year. So if I do something that's questionable, or I don't think is going to last a long time, who's going to deal with it?
Yeah.
Me.
You're
You
gonna
know, I'm going to
right?
be here to, and so I have to stand behind my work for as long as I possibly can. So that's where I really find the value in each one of us. You know, we're not transient here, and you get that in a lot of corporate offices. I think the average dentist stays in a corporate practice less than a year, and I see that a lot of my buddies who graduated dental school with went into corporates. Some of them are in their third or fourth job by now.
Well, I would imagine that it like I said, it's a lot of pressure for
Right.
for them. I know I went when I first came to this area. I went to one that kind of became a corporate dentistry. It wasn't originally, but it got gobbled up, I guess.
Right.
And so it was on the third or fourth dentist that I can think of before I finally said, I just no, I'm out.
Yeah.
And so I switched over, but it's you don't want that. And even as you mentioned before, if you've got you're doing a 6-month cleaning and everything's just great, that's wonderful. There's no guarantee that it's always going to be the case.
Right.
That next 6-month cleaning, they may say, okay, well you got kind of a little bit of a buckle or a little bit of a pit here that you need to get fixed, and so that I think is a big difference between your office and another one that might have just done the 6-month cleaning and said, okay, see you in 6 months.
Right.
And until it gets really, really bad, they won't even let you know.
Right.
Right.
Yeah. So that's a huge advantage, I think, for you all. Now, X-rays have come a long way.
Yeah.
Holy cow! I mean, before the X-ray used to be, they put that 70-pound U.S. military style weight on your chest, and you would sit there just gasping for breath, laying there in your uncomfortable chair, while the technician points this massive gun thing at the side of your head.
Full of radiation.
Right, full of radiation, and then runs across the street to Culver's and
Presses a button.
Presses a button with an extremely long extension cord because she's not going to get zapped, and so and that's how that used to work.
Right.
But now it's a much more refined, precise process. I mean, even that element, which was, I thought, pretty medieval back in the times, there has gotten a lot better. Explain or describe how it is over there at Lakeside now.
Yeah, so we actually use, they're called nomads. They're basically like kind of a mobile X-ray unit. And what it's done is it's compacted all of that into a much, much smaller size. And what that does is it minimizes the radiation. So not only are we using less actual amount of radiation, but
Right.
the surface area is also much more accurate. So what that enables us to do is we can bypass the whole ballistic vest situation. It's much more comfortable for the patient. The staff is in the room while they're taking the X-rays. Very, very minimal in terms of radiation. So it's just like works out better for everybody involved. It's safer for our staff, and it's also safer for the patients. And we've invested in that technology to just make it more comfortable for everybody. I want patients to know that this is very normal, it's very safe, we do it day in and day out, and it's okay. So.
Well, and that's a big difference. I mean, because like I said, you guys have like some state-of-the-art equipment there, where you may not have that at another place down the street or another place in town. You may still kind of be more old school in that way.
Yeah, I mean, as soon as you press that button, within less than 2 seconds, you have the image digitally of that X-ray. So if you need to get a different angle or get a different area, you just take it again, and it's such minimal amount of radiation that I
Right.
tell people just a few days out in the sun in Florida is about what you're getting.
Yeah.
In our full series of
It's
X-rays.
less than TSA at Orlando Airport.
Right. Yeah. Those
exactly.
guys do a lot more.
Yeah.
So it is pretty impressive.
Yeah, no, it's awesome. Like I said, that's just one element of the investment that I think Dr. Willie has put into the practice there to really keep things current, or like I said, the very kind of leading edge of the practice. And another thing I think is you were I know we've said before, you all can do things and make molds in like one day, or as you're sitting there waiting, where normally would have taken weeks or if not months.
Yeah, yesterday I had a patient, and we did a root canal and a crown all in one day there, and he was talking about how he previously was seeing a dentist in Fort Myers, I believe, about 2 hours away, and he had a crown done there a couple years ago. 15 minutes later on his drive home, that temporary crown fell out.
Oh my
gosh! And so we're able to skip that entire process. You know, we occasionally do temporized teeth, but we still use a machine to make these temporary crowns. That sometimes the fit on these crowns, even if we put it on temporarily, is so good that we have a little trouble getting those things off. You know? And so gone are the days of having to worry about your temporaries falling off if you're having temporary. But I mean, I would say 90% of the time, you come in planning for your crown and you leave maybe 2 hours or less later with your final crown permanently cemented. You go home, you eat, you drink, you brush, you floss. You don't worry about that thing coming off, which is pretty impressive.
So no special requirements. Hey, don't eat anything, don't chew anything on this side of the mouth for like a day or something like that. You can go right to
no more waiting a couple weeks for it to come back from the lab and putting it in and then hoping that it fits and then having to grind and grind and grind. Patients don't like when you put a crown in their mouth and then you spend 10-15 minutes grinding on that crown.
Oh yeah.
And so with the technology we have, it's so much more accurate than what we can do handmade by man in a lab. And so even labs have gone to use this technology now. So they're not making crowns by hand necessarily as much anymore. They're doing it all with technology. And we're fortunate to have the same technology that they're using right here in our office to make it a little bit quicker.
That's amazing. So Dr. Campano, how long, if to get a crown, how long would the patient, once you kind of have it ordered and you need to make it there in the back by the lab there, how long does that patient maybe sit there while waiting for it?
I'd say anywhere from an hour and a half to 2 hours.
That's it?
The size of the teeth.
It's like 3 or 4 episodes of Animal
Well, that's like
Planet.
that's your entire appointment time.
Right.
So the amount of time we work in the mouth is about 30 minutes.
Right. Yeah.
And then when the doctor and assistant walks out of the room, 30-45 minutes, and hey, we got a TV there, you can watch TV.
Yeah, get to watch
30-45 minutes, the crown's done.
You guys got cool shows on there. There's food channels on there, Animal Planet. I mean, it's all good stuff. I don't have to worry about watching politics and stuff. It's all happy.
Some people want their politics on in there too. We try to stay away with that. But
we're trying to release the stress.
My favorites during College World Series, we got baseball all day long. During the Masters, Thursday, Fridays, we got the Masters on.
So do you ask the patient what they want, or you just turn it on and just hope to God they don't ask to change it?
Yeah, no, we got. The girls know where all the good shows are, but patients love when it's lunchtime and you're like finishing their crown and there's Martha Stewart cooking some good homemade meal.
Oh, there you go, exactly. Give me ideas for dinner.
So
now you can probably get all kinds of side item ideas for Thanksgiving and such. Yeah, so very good. Of course, talking with Dr. David Campano, Dr. Dalton Helvey, Lakeside Dental Arts. LakesideDentalArts.com again is the website address. Phone number 863-658-4288. So much more to cover, and we got to talk about what you guys are doing, because there's a little bit of a food drive going on there at Lakeside Dental Arts, and we've got to touch on that a little bit as the medical hour continues in just a moment. Medical hour. Talking a little bit with Dr. David Campano, Dr. Dalton Helvey, Lakeside Dental Arts. We're talking about how local companies can really do well for you. In particular, of course, when we're talking about dentistry. And we're talking about dentistry, there is no business in Highlands County higher rated and more just universally loved by their patients than Lakeside Dental Arts. 2660 US Highway 27 South. And you folks, in addition to, by the way, working 8 to 5 or beyond, depending on the day, you also are huge in the community, and you've done a lot of stuff in the community. Everything from, of course, the day of giving that y'all do. Usually it's around September-ish that you've done that, where you just do a whole day of free dental procedures. There's like 3 or 4. I think it was extractions or cleanings or maybe fillings. All of that was, and you did just a ton of them all day long, nonstop. You of course are sponsors. I remember you all sponsoring, I think it was Miss Highlands County pageant last year. You did. You've also sponsored, of course, the Alan J. Greater Sebring Chamber of Commerce Scholarship Luncheon that we do, where we honor just a bunch of the best and the brightest of our seniors from Sebring High School. And you'll do different things. I mean, I think one time you were here, we were talking about the the bus, the One Blood bus, if
Yeah,
you will,
we
was
still
gonna be
do that a
there.
couple times a year.
Yeah, yeah, and so, but you've got something else going on now, and of course it's perfectly timed for the holidays. There's a food drive.
Mm-hmm.
So let's talk a little bit about the food drive. So I mean, have you rounded up a couple things? How long has it been going on? All that stuff.
Yeah, it's been going on the last few weeks, and we just have a food collection there in our reception area where, if you have anything to clean out that pantry, non-perishable items, it's going here locally. We're not shipping it out anywhere.
Okay, so was it a local food bank or one of the
local
okay.
food bank will pick everything up. So
Nice.
through the end of this week, we encourage our staff, our patients, and to contribute to that. It's just so good. It goes local. And
Sure.
there's such a need, especially right now with everything that was going on with the shutdown. There's so many people that are truly in need of food items, and it helps right here in our own
Well,
backyard.
especially right before the holidays. I mean,
Right.
the demand I don't think has been this great in a long time.
Mhm.
So even from COVID days, I mean, I know that there are really a lot of people just hurting
Yeah.
here in Highlands County. And so you can drop it off at Lakeside Dental Arts.
Yeah.
Yep.
So you don't even have to have an appointment. You just if you want to, just stop by. Publix or Winn-Dixie or wherever, and just get a couple buy one get ones.
Oh yeah.
And or clean out the pantry like you mentioned, and then just bring it over there to Lakeside Dental Arts. And you said you have to do it by tomorrow.
Yep.
So
today and tomorrow.
So today and tomorrow.
And bring it in by any time. Just come on in, and we're grateful for the support. It's a chance for all of us to give back to our local community.
Yeah.
And, it's a lot of fun to do.
Yeah, well, and it'd be cool. So do you have quite a bit collected already, or no?
Yeah, I'm not sure how tall the mountain is right now, but I know there'll probably be a picture posted before we ship
Sure.
everything off to see how tall we can get it. So come in the last few days, like you said, go get some BOGO items, some cans that we can stack tall,
Yes.
and have a lot of fun
Yeah,
with it.
boxes of stuffing are good too because they're taller.
Oh, yeah.
Yeah, exactly.
Yeah,
So
Stuffing.
you don't have to-
Yeah, and stuffing, cereal, mashed potatoes.
Yeah.
I'm just trying to think of stuff for the holidays, but all those things would be huge. So
Yeah.
good, very good, excellent. And what else is coming up on the community front that you can think of? Anything you guys sponsoring pageants again this year?
Yeah, I think we're planning on being back at the pageant, which is a lot of
It's almost
fun.
that time again.
I know it comes quick.
I know, and
Dr. Campano hasn't had the pleasure of
no, you haven't.
having that fun, but it's
yeah.
awesome.
It's a fun event to do, and the young ladies they work so
Oh, my
hard,
goodness.
and of course there's like 4 different pageants for the different age groups. You got like Little Miss, Junior Miss, Miss. I think there's Teen Miss. I think it's the 4.
Yeah.
Yeah. So at some point though, you would think based on our demographics, I'll be a Senior Miss in there somewhere. But we'll get there. We'll get there. But there's a lot of people there, and of course, just full of family and friends, and it's great that you all step up and sponsor that. And of course, they're available for the big check and the presentation, and to stand next to the young lady who's just beaming with a crown on. So
Yeah,
it's a lot of fun.
Yeah, they work hard for that, and then it's so cool to see them throughout the year as well. Involved in the community events. It's not just they don't just get the prizes and run.
Yeah.
It comes with a large responsibility.
Well, you'll see all of them usually smiling and waving from the back of a convertible during the Christmas parades,
Yeah, absolutely.
the holiday parades. And you guys,
You'll see us right behind them.
I was gonna say, you're going to be in the holiday parade in Sebring this year.
Yeah, so be on the lookout for a really huge purple float. If you're in our office, purple is a prime color.
That's a
there.
big thing, yeah.
So this float has been, like I said earlier, it's been doctor built, and our staff
Okay.
all gets together. We're getting together tonight to kind of finish the crafting side of it. It's going to be beautiful. They always do a great job in crafting it. If it comes down, it was not built by the doctors. If it stays all in one piece,
Yeah.
it was definitely
That was
built by the
it there. Yeah, exactly.
Yeah,
So and there's no truth to the rumor that any kind of dental cement was used
Right,
to
yeah,
create this whatsoever. But that's great. All right. So are you pretty good, pretty handy? I mean, obviously, I would think
And
to
you
some
helped
degree.
to build the float. We had some help though, for sure.
Yeah.
That's good. Okay.
I was, we're obviously putting screws into boards, and I had
Yeah.
to make the parallel to placing implants to Dr. Musa, and it clicked at that point.
Oh, okay, that's good.
Right, so we need these screws to be parallel, Dr. Musa, just like your implant. But implants are a game of like less than a millimeter.
Yes.
A 12-foot float, we can work with some millimeters there.
A little more
couple
margin
inches,
there,
So
yeah,
I was like,
yeah.
we don't have to be as exact as the implants.
It's precise.
But
No.
you want it to be.
Yeah, no, that's very good. So, all right, so you guys are going to be in the float. So watch for that. Of course, Sebring, 10,000 or so people are gathered along the sight line there. And we all be handing out candy in a massive bit of irony, or no?
I believe so. You would think we'd pass out like toothbrushes or toothpaste,
Little
but
flosses or something. Yeah.
the kids probably don't want that. They don't want anything to do with a toothbrush or
Look at you
they
guys.
want candy that night, so we're gonna have fun.
Candy and a business card, yeah.
Yeah.
Generating a little future business. That's it. Enjoy this. See you next week. That's great. Okay. Awesome. Again, Dr. Dalton Helvey, Dr. David Campano, Lakeside Dental Arts. Phone number, 863-658-4288, lakesidedentalarts.com. Guys, we got to talk food. We cannot go a medical hour and not talk food. So we got to find out where you all have been eating and what restaurants you would highly recommend here in Highlands County for our listeners and for your future patients. You guys can kind of talk about that next time they are in there on those comfortable chairs. It's the medical hour with Don Elwell and Dr. Dalton Helvey, Dr. David Campano. And we're talking, of course, Lakeside Dental Arts. And we're near the end of the show, so we kind of shift from Lakeside Dental Arts to, okay, where have you guys been eating lately? So what do we have any good local restaurants or chain restaurants that you've eaten at locally here?
Yeah, so we get together once a month, the doctors, and last time we got together, went to Gavigan's. And
Oh, the Irish pub.
Irish pub, yeah.
Yeah.
I've been there a couple times. I like it a lot just to go. It's a good kind of atmosphere there.
A lot of alcohol. This was after hours, right?
After.
Okay, good. Thank you.
On our lunch break, actually.
Yeah. Good luck to the afternoon patients. No, okay.
We'll be all right. No, but I ended up getting a shepherd's pie there, and it was actually pretty good.
Oh yeah, I've heard good things about the shepherd's pie.
Yeah.
It was good.
Yeah, I had a good time. Burned the roof of my mouth pretty bad, but that's all right. I know
Well,
the guy.
Better that than cold. Yeah, exactly.
Yeah, that's
and
true.
And you went there too, of course.
Yeah.
And what did you have?
Yeah, they had a special lamb shank, braised lamb.
Yeah.
It was really good.
Very good.
A lot of carbs, heavy carbs. The Irish love their beer.
What did
and their
Dr.
carbs,
Musa
so.
have? Did he
He
have
had
anything?
the lamb shank as well.
Did he?
Yeah.
Oh, I'm so proud of him.
I
This is
know.
good. He's coming around.
We're getting there.
Okay, that's good. And how about yourself? Have you been any other places besides Gavigan?
Yeah, I mean, locally we kind of go to many places, but just outside of our backyard is Port 27.
Yes.
And we've
Yeah.
been dying to
I've
get
heard
up
good
there.
things about that.
We
Yeah.
finally went up there a couple weekends ago, and now that's where we're trying to plan all of our date nights and couple date nights.
Really?
It's just a really sweet atmosphere, especially as the weather's getting nice now.
Oh,
I don't
sure,
recommend
sure.
it in June or July, but it's just outdoor atmosphere, right on the water there.
That's up Lake Hamilton, right?
Yep, right off
Yeah.
of Lake Hamilton.
Okay.
So it's about 45 minutes up the highway there.
Yeah.
And, I mean, that place gets busy. I
heard
recommend valet parking $10 because
Okay.
if you go there on Friday or Saturday night, good luck parking.
Might as well just park in Avon Park.
Exactly.
Okay.
And just carpool with somebody else.
Yeah.
But no, they have multiple food options: burgers, wings, hot dogs, tacos,
Nice.
ceviche. And we hadn't tried the pizza there yet. That's what we're going for next.
Yes.
Is a little pizza spot, but
Do it.
multiple areas, little breweries, and little craft areas.
Okay.
All kind of ice cream, plenty of stuff to walk around. It's like a little mini. It feels like with how busy it was, it feels like you're in the middle of a theme park right
Like
there.
a little
off of
mini
27.
Epcot kind
Yeah,
of thing
I mean it
going
gets
on?
dense population wise, but
Holy cow.
it's sweet. It's a really cool area. It's encouraging to see something like that local pop up and be so busy.
Yeah.
And I don't see it getting any less busy. I think they're planning to grow and expand. I know one of our local water sport vendors is also up there.
Okay.
You can rent water sport, jet skis, pontoons, kind of
Oh, perfect.
water bikes and stuff. So even during the daytime, they got live music, all kind of cool stuff.
Yeah.
We'll definitely be back.
Okay, very good. Yeah, I'd give that one a try for sure. Have y'all been to a Jinsu Kitchen yet?
I have not, and I want to.
Went there,
How was
and
that?
it was good. It was very good.
I'm
It's
sure.
it's fresh. It's
Yeah.
fresh Asian food, whether you want Thai or Chinese or sushi or whatever. I mean,
Yeah.
it's all fresh, made on the spot there. So it was really good.
Yeah.
I had squid salad.
Ooh.
Yeah, would not have. I'm McDonald's right here, and squid salad. Not something I was
Different
going
texture.
Different texture, a different smell. Definitely want to bring the Tic Tacs for that one
Yeah.
afterwards. But yeah, no, it was good. It was good. I would definitely recommend that one. It's across from Blue Lagoon. They're on North US 27.
Yeah, they're local too. I think the owner Lisa, I
Absolutely.
graduated with her.
Yeah,
when we went to
and
school
they started King Tong.
Yeah.
Yeah.
We used to see Lisa at King Tong all the time, and now my wife was like, she's not there anymore. She's she opened up Jinsu. I was like,
Yeah.
then we definitely gotta go.
You got to go to Jinsu Kitchen for sure.
yeah.
Absolutely. Lakeside Dental Arts, by the way, if you would like just outstanding dentistry all the way through, from Dr. Campano, Dr. Helvey, Dr. Musa, Dr. Willie, of course, just fantastic, highly reviewed. You're going to find very few people that have anything negative to say anything about them at all, and you can't say that about a lot of businesses. If you have a good relationship with the dentist, that's wonderful. If you don't, or you're looking, or you haven't been one for a while, LakesideDentalArts.com. Cannot recommend them enough. 863-658-4288 is the phone number. Again, they're located at 2660 US Highway 27 South, across the street there from Culver's, speaking of food. And just a great people and a great environment. Like I said, it's like a spa when you go inside. So guys, have a great Thanksgiving. Any big plans?
A lot of cooking, a lot of eating.
Okay.
We're going to be at my house this year, so that's a lot of fun.
Okay. All right. How many are you cooking for?
Probably around 30.
Ooh,
Yeah.
that's a big bird.
So shout out to my wife. She holds the fort down.
Oh,
I mean,
good
I just
job.
throw a turkey in the smoker. That's
Oh,
all.
okay, that's not too bad. But it'll be a big one this year. For
Oh,
sure.
yeah.
How about yourself?
I'm heading back to my parents' place, a couple hours south of here. So
Okay, where's that at?
it's Pembroke Pines.
Oh yeah, yeah. Okay, very good, excellent. All right, guys. Well, again, have safe travels for traveling out there, and safe holidays to everybody. Happy Thanksgiving to all, and we will do this again very soon on the Medical Hour. Thanks for tuning in.